Did you know OCD affects approximately 1 to 2% of the population? And that prevalence rate is consistent regardless of ethnicity, sex or background. However, interestingly, the nature of OCD can vary depending on a few factors. Firstly, the content of obsessional thought seems to stem from what is culturally relevant to the sufferer. For example, it's found that OCD sufferers in Middle Eastern cultures are more likely to experience obsessions related to religion. In East Asian cultures, OCD symptoms are more likely to be around symmetry and order, and Western cultures tend to see higher rates of checking and counting. It's thought that the differences in these symptom profiles might be associated with differences in cultural values. Secondly, OCD can sometimes latch on to whatever's commonly feared in the media at a particular time point. For example, in the 80s, where there was a lot of fear in the media around HIV and AIDS, lots of people found that OCD focused obsessions and compulsions related to that. Thirdly, although rates of OCD stay consistent across the lifespan, the content of obsessions may vary depending on what's important for a person at that particular time. For example, it might be that after having a baby, OCD is more likely to prey on thoughts of hurting the baby. These things make sense. OCD is powerful as it often gives us thoughts that we consider to be the most abhorrent and distressing, and that can vary depending on our personal values, which in turn can be influenced by our cultural views, what we're exposed to in the media, and life events. It's important to say that whatever the content of OCD, it's a really treatable mental health condition, and with the right treatment has really good outcomes. We do also know that there are inequalities in who accesses support, with Black and minority ethnic communities identifying certain barriers to seeking support. So it's really important that as services, we work to try and address these barriers and reduce inequalities, and to ensure we're generally providing culturally competent practice.